So you talked a little bit about it. What does that, on the AV side, what does that titration look like for, just a little deeper dive into what that might look like.
So on the Tirzepatide front, our clinicians are going to assess each patient, individually. If someone has a higher A1C, they might come in at a 1.5 mg, but they're still going to divide it into maybe 2 to 3 dosing, so you're not getting bombarded. If someone has not as bad of an A1C, and an A1C, if you don't know, it's your 3-month glucose average, right? And so the higher that goes, the worse off you are metabolically speaking. So if someone's not that bad off, our clinicians might say, hey, let's just start at 0.75 mgs a week, 0.375 twice a week, right? Such a small dose. You're barely going to feel it in terms of your stomach. You're not going to get that intense constipation right away, all that bloat, or even the reflux that can come with these things. And you're just going to start getting the slow benefits as we go, and we can titrate up. So they still have a lot of leeway, but generally speaking, we are going to start under that 2.5. But, our clinicians will dose it based on how severe your case is and what your goals are, right? Someone who's trying to lose 30 pounds maybe might start just a little bit more aggressive, especially if their A1C is really high, than someone who's losing 10 pounds and their A1C is maybe just a 5-6, right? But either way, it's going to be a microdose, and generally it's going to be spread over a couple days. Semaglutide, like I said, the medical dosing starts at 0.5 mg. I took that the very first time I ever took it, and holy cow, like I had reflux, I didn't want to touch food, like it was not a good way to start. So then I started at 0.125 mg, and that was a much better way to do it. And then every 3 to 4 days I would hit that, and then I was doing okay. So we are still somewhere around there, 0.125 to 0.25 mg.
Start dose.
Yeah, and then we can work up, see where you're doing, see how you're doing. You pair these things with lifestyle, and we'll talk about that for the muscle preservation module, but that's more in line with where we are and why we do what we do.
So to wrap the dosing part up, is there an importance also on the other end of that, titrate down? So, I'll say a lot of people don't even think about coming off of GLPs, but that's should be the goal. Maybe not to come off, but to cycle. Because I suspect that there's an adaptation where your body can get used to it. And so it would make sense to titrate down, come off, and come back on. So does that also make sense?
One of the reasons that GLP medications came about for diabetes and things of that nature was because they were noticing that years and years of straight use of metformin was no longer working. And so they needed to find another way. And that's because patients were just being left on that nonstop, right? And your body just finally gets used to it, just like thyroid meds or anything else. And so what we try to do is, as you've gotten closer to your body comp goal or your goals or your lab marker goals, what we try to do is slowly bring the food up. Our clinicians will give you some guidance there. If they're not there to be your nutritionist, you can get a coach like me, right? But they will give you some guidance. And as the calories start being inched up, we will start inching the medication down. Now, I find the younger someone is, the more likelihood they can get off of it completely. And I find the older someone is, and the more they, especially women who have been through menopause and all that, they might do best titrating back to maybe like a 10 units, which
like
would maybe
just
be
a lower
MIG.
dose.
Just a MIG as a lifestyle maintenance thing to keep that A1C good, keep their trigs good, because we know these things help your cholesterol. They keep they help neuroinflammation. So let's say that person has dementia in their family like I do. I will be running a GLP on and off for the rest of my life because I know what it does up here. Dementia is type 3 diabetes of the brain. So why wouldn't I use this medication to keep that neuroinflammation lower, right? So all that's going to be coming into play with our clinicians. But yes, the goal would be not to stay up at the highest dose you had to work up to. Not only is it expensive, but if you had all the right lifestyle changes going along, then you should be able to bring that down because you got healthier, right? You're doing all the things you need to do: nutrition, walking, sunlight, training. Now your body is going to be able to hold that insulin sensitivity that the drug helped you create. So it's a tool, not something that be done forever.